Hello, it's so glad that you're able to tune in. I once again have Dr. Kelly Rose with me today from our medical director at Peter Becker Community and also a physician at Tri-Valley to answer questions about the COVID vaccine. We are both going to keep our masks on today even though we're 6 feet apart. The surge in Montgomery County is so high that we're feeling that it's not necessarily safe, even at a distance, to be around someone without a mask. So I hope that you can hear us both well. We'll try our best to enunciate and to be loud. So I want to start out asking Kelly, how do we know the vaccine is safe? We've heard it's coming out, we've heard rumors it was rushed.
So when a vaccine is developed, the two most important things are, does it work and is it safe? And safety is probably the most important of the two things that they look at. This vaccine process was very fast, but in the process of developing it, no safety steps were skipped. The reason we were able to do it so quickly, and by we, I mean the fantastic people who do this research, is because they worked 24 hours a day, 7 days a week, and it was a global effort. And they were using technology that was already in place. They say this is a new vaccine, but this is not new technology. There were 3 phases of safety trials. More than 50,000 people have received the vaccine. There have been mild side effects, but there have been no documented cases of severe side effects from the vaccine. And so at this point, we really do feel that it is safe.
That's great. So what about the effectiveness of it? We talked on our last video about it might come out and only be 50% effective.
The great news is that the 2 vaccines that hopefully will be available by the end of this week were both greater than 90% effective, 94 and 95% effective, which is just fantastic news.
That is, I'm excited about that.
Yeah.
But can I get COVID from taking the vaccine?
100%, you cannot get COVID from getting the vaccine. There is no live virus in the vaccine. There is the coding material to generate a protein that is found on COVID in the vaccine, but there is no virus and you cannot get COVID from the vaccine.
So what are the side effects that I should expect, or will I get side effects?
So about 10%, 10 to 15% of individuals could experience some side effects from the vaccine. These are side effects that are familiar to folks from getting other vaccines. Many of you may have gotten the shingles vaccine, and you have heard that there are side effects of body aches, fatigue after getting that vaccine. Those are the similar side effects that one can experience from the COVID vaccine. Again, it's about 10% of people who will experience it. It may include low-grade fever, fatigue, body aches, nausea. The studies have shown that those side effects resolve within 48 hours.
I had the shingles vaccine and my arm hurt so much I had a hard time moving it, but I was very happy to get the vaccine because I've had shingles before and I didn't want it again. Why should I get this vaccine? I mean, some people have said, oh, I'd love to wait a year to get it, but we're asking people to get it.
I think it is so important for people to get this vaccine. Getting this vaccine will significantly reduce your risk of getting the disease, of getting sick from the disease, of needing to be hospitalized, and maybe even dying of the vaccine. And more importantly, it's going to help reduce the burden on our healthcare system that we are experiencing right now. Most of our ICUs, even locally, are at capacity. And so for people who may end up at the hospital for other reasons, our resources are stretched just way too thin right now. And I think we all need to do our part to make that better.
I saw today on Montgomery County data source, I think that there were 1,500 positive tests. I believe it was a 3-day period, but that's just outrageous, 1,500. I mean,
In our county.
yeah, in our county, right here where we are. What if I've already had COVID-19? Do I need to get the vaccine?
So right now the recommendation is yes, you are eligible to still get the vaccine. We do know that the immunity that one experiences from getting the disease may be self-limited, and they are suggesting that the immunity that you can get from getting the vaccine may give you better protection. So certainly they have found that there is no harm in getting the vaccine if you've had COVID, and certainly there may be additional benefit.
So if I get the vaccine, can I stop wearing my mask and go eat dinner with everyone and do whatever I want?
So the very unfortunate answer there is no, at least not right away. What we don't know yet is that even if you have the vaccine, if you come in contact with the virus, you yourself may not get sick. But what we don't know is if you're still able to transmit that virus to someone else. Hopefully we will know that information in the upcoming months, but for now, the recommendation will still be that everyone needs to wear a mask to still help reduce the transmission of the disease. Hopefully we're just going to see a whole lot fewer people be really sick.
I heard, I think yesterday on the news, Dr. Fauci thinks that all Americans will have the opportunity to be vaccinated by May, and that then we would have herd immunity. How does that really work?
So, if everything goes right, and there's a lot of steps in this process, from production to administration to people being willing to get the vaccine, hopefully by this summer, we will have had enough individuals get the vaccine, and we're looking at a number close to 70% of Americans and wanting them to get the vaccine in order to be able to achieve herd immunity, so that we will dramatically see the incidence of COVID drop off.
Are there people that should not get the vaccine?
So as of right now, the vaccine is not indicated for children. The Pfizer vaccine has been approved down to the age of 16. The Moderna vaccine will only, if approved, will only be approved for individuals over 18. And neither of the vaccines were studied in pregnant women. And so the option has been left open to women who are pregnant, that if they would like to get the vaccine and they discuss it with their doctor and they think that the risk outweighs the benefit for them, they are eligible to get the vaccine, knowing that the vaccine has not been studied in pregnant women. But other than that, the group of people who should not get the vaccine right now are people who are actively undergoing chemotherapy. And that is not because it would be dangerous for them, but because their immune system has been knocked down by the chemotherapy, they likely will not create a good reaction to the vaccine and will not get the benefit.
Do you see that our country will mandate the vaccine, or I guess we don't know?
As of right now, there cannot be a mandate for that vaccine. Right now, the vaccine is being approved under an emergency use authorization. And what that means is that the vaccine has gone through this advisory panel at a pretty rapid rate, that we are under a state of emergency, and that the vaccine is being very quickly authorized. Again, that doesn't take away from the safety, but know that there is ongoing safety studies happening. When something is approved through the emergency use authorization, it cannot be mandated. Now, the vaccine may become approved through more traditional channels very quickly, and so that may change. I am hearing rumors of venues, and concert venues in the summer who will be hosting events, and they're already planning to say that people need to show that they've had the vaccine before they come in. I don't know how much of any of that is legal, and I don't know how much any of that is real and just rumor.
Yeah. This is an important question. If I get the vaccine, when will I start to be protected? Immediately, or?
So each of the 2 vaccines that are being approved are a 2-step process for vaccination. Each individual will require 2 vaccines, anywhere from 3 to 4 weeks apart from each other. Immunity is not considered to occur till about 2 weeks after the second vaccine. So you're looking at, from time of first vaccine, about 6 weeks till you can be considered protected.
I don't know if this is a fair question. Are you going to get the vaccine?
100%. That is a fair question. And I will get the vaccine as soon as it is available to me, whenever that may be. I am anxious to get it. I'm anxious to get protected, and I'm anxious to show my patients, my colleagues, my friends, that I think that it is safe to get.
Well, I'm in the same. I can't wait to get it, and maybe we'll get it on the same day, as soon as we hear that it's available. I don't have any others. Is there anything else you can think that I didn't ask that people really should know about the vaccine?
I think the one other thing that I'd like to say is that one of the things that I am reading and hearing people say is that they're hearing rumor that this vaccine can change your DNA. And I want to dispel that myth as being 100% not true. I think because in the description of the vaccine, they talk of it as a messenger RNA, which is similar to DNA vaccine, that there have been a lot of, it's been a lot of false information put out there. The vaccine does not enter the nucleus of a cell. It cannot change your DNA. And so I do want to really dispel that myth that is out there, because that is one thing that I'm hearing from a lot of individuals. I would encourage people, I'm here at Peter Becker on campus. Please don't be afraid to stop me if you have a question. I'm happy to talk to anyone about it and to address any of your concerns.
I have had people say to me that their concern would be that there's some sort of long-term effects that no one is aware of because it's new.
Mm-hmm.
But to me, I would suggest that we have to also look at the immediate known effects of COVID, which are pretty significant. This vaccine is similar to other processes that have been in use for 10 years. So is that likely that there would be an unknown long-term impact of the vaccine?
So I certainly think there would be no one who would ever say, 100% there's no impact. But you're absolutely right that this is technology that we've been using for over 10 years for other development of other drugs, not vaccines, but it's the same technology, and there have not been any long-term consequences related to that. At this time, we don't believe there are any long-term issues that should be found from the vaccine. And I absolutely agree with you that the immediate tragedy of COVID is so real, and that truly this vaccine is our path out of this, and our path to getting back to some sort of sense of normalcy in our world. And I think that that benefit far exceeds the potential risk.
So we are still waiting to hear when we're getting the vaccine. We hope any day that we're going to get the call that the 3 dates that will be available for all of us to get the vaccine, and all employees and residents in skilled and personal care will be first. And then we'll continue to work with our local legislators to try to figure out how we can host vaccination clinics on campus for our residential living residents. But thank you for being here today and answering my questions.
Thank you.